That's the sound of the coffee pouring. Welcome to the Doctor's Brew. I'm your host, Dr Abdulaziz and having coffee with us today is Dr Mohamed Alfadhalah. Welcome.
Thank you very much for having me.
The pleasure is all ours. Mine. Now, the topic of today is going to be how to make the most out of your trainee year or intern year, specifically to Kuwait, just in case we have any listeners abroad. We're going to be focusing a little bit on intern year in Kuwait. Now, before we get into this very interesting topic, let's talk about our coffee. Very important, right?
Yeah.
What are we drinking today?
We're having an iced Americano from Caribou.
Iced Americano from Caribou. And one thing about Caribou, I just found out that it's Canadian.
Yeah, it is.
I had no idea. Well, this is going to link up a little bit to our topic today because as most of our listeners know, most Kuwaitis who go abroad for medical training end up in Canada. So,
yeah,
very apt.
That's true.
And it's already dripping onto the table. All right. So, Dr. Mohamed, who I'm now going to refer to as just Mohamed. Again, it feels awkward to keep putting doctor in front of everything.
You just call me Mohamed, please.
So tell us your background a little bit.
Okay, so I graduated from the American School of Kuwait in 2014, and I continued my undergraduate work in Kuwait University's Faculty of Medicine. It's a 7-year program. I graduated, and then I started my trainee year in Amiri Hospital, and I'm an assistant registrar now in the internal medicine department at Amiri Hospital.
And fun little story for me. So imagine me fresh out of Manchester, coming to Kuwait, and I come into Amiri Hospital. I'm really nervous. I'm looking around confused, okay? And suddenly I just look off and I just see, is that a Mohamed? Because I went to ASK as well,
yes,
the American School of Kuwait. And I was very, very lucky to have Mohamed right there. He was an essential part towards easing me into Amiri. And I'm not saying this just to be nice to you. Really, because it was just nice to have a friendly face. Now, little word of warning, I think you might want to bring your mic up a little bit closer up towards you. Yeah, there we go. Perfect. You're good.
Yeah, I'm good.
What's the worst that can happen? It falls? Adi thought. Mohamed was the one who mentioned to me that this would be a great topic for him to speak on. Can you tell us first, like, why do you think this is the topic for you, that you wanted to come and talk about this?
Okay, so after I graduated from the Faculty of Medicine, I wanted to get things up to speed as fast as possible.
Sure.
I didn't really want to wait to apply to the universities in Canada. I'm just that kind of person in general. I'm always looking for the next opportunity. And I was also afraid that I might, not be on time with the exam dates, or I wouldn't sign up early enough. I'd just keep pushing it forward until I'm 2 or 3 years into my work, and I still don't have a clear plan, or I'm not a resident anywhere. So since Canada has been my goal for many years, I just I wanted to get things up to speed, as I said. So I found a few ways to optimize my trainee year to make my application as best I could, or the most fitting for my situation, because most people, apply when they're assistants.
Yeah.
So that experience factors in. It's always a positive for the admissions board.
Really?
Abroad, yeah, it is.
The earlier the better.
Actually, not the more experience, but when you're an assistant, you always have that edge. You've been,
So it's better to apply as an assistant.
Actually, I found some universities, they asked me that question in the interview. Yeah, they said, why should we take you? You're still a fresh graduate. There are other people who have experience under their belt.
That's actually interesting, because I heard that it was the opposite. You want to get it. They want fresh graduates. At least that's what I heard for the U.S. I don't know if it's different for Canada. Maybe it is.
That's the rule of thumb, but for some universities. But there are others who actually look for experience.
Oh.
So I wanted to.
I mean, it makes sense. Logically.
Yeah, it does. To be honest. But I wanted to fill in that gap that I had, or that disadvantage, by optimizing my training year or making the most out of it. So I devised a plan, and it worked perfectly for me.
Looking back, do you think you had a successful trainee year?
Yes. I feel like, I flipped my schedule around. I've been in rotations alone, basically. You know what they say? Try to start with medicine, and then everyone goes to pediatrics, and then everyone goes to surgery, and then everyone. So the delegation of tasks is a lot easier. You have, 4 or 5 people in one unit with you. So the division of cases is a lot easier. You have less of a workload.
Well, the counter to that, do you think that kind of going with the flow of traffic helps in terms of like maybe studying for your exams?
Oh yeah, definitely. But I escaped that trap, if you will, by taking my exam right after I graduated.
Oh, so you took fresh out of med school?
Yeah, I graduated in July of 2021, and I booked my exam for the 8th of November.
Oh, okay. And then when did you start working?
I started working on the 14th of September, actually.
Okay, so you were pretty much right. Okay.
Yeah, okay. I wanted to. So the idea behind it was, obviously, once I graduate, I have like a week or like 10 days break after graduation. Then I start studying. And I also wanted to work early so I can, get my recommendations in line.
Right.
So I kind of got the best of both opportunities, if you will. However, the disadvantage for me was I had to work twice or maybe even 3 times as hard as my other colleagues.
I guess it paid off.
Yeah, like in surgery, I was maybe the first 2 weeks I had a few other trainees, and then towards the last 2 months, it was just me and like one other person.
In surgery.
So I would see like 31 cases in the weekend run. Yeah, it was like, I wouldn't say that I enjoyed any of it. It was really tough for me. However, it did make me a better physician.
That's interesting. So you didn't enjoy it?
I know I did. Obviously, I didn't. No one really enjoys that big of a workload, that unnecessary workload, especially when people finish the rotations and they tell me, we only saw 2 or 3 cases a day, for example.
Yeah.
And I have to end up seeing 31 in a weekend round. So that's not fun.
No. 31?
Yeah. There was 1 weekend
round. And you wrote all the notes?
I wrote all the notes.
By hand?
By hand.
Vitals are best, huh?
La. I worked really hard to make sure that all my notes were, the end patient safety is uncompromisable, right? But
that's really admirable. It really is.
Yeah, but as I said, or as I was saying, it wasn't really, a nice, a comfortable experience for me. However, I just had to. I had no other choice. I had to push through it.
Yeah.
And in the end, it made me a better physician because my stamina increased. I get, I have the advantage of me being able to absorb a higher volume of cases at such a very young part of my career, or the beginning of my career,
True. And now, okay, so I think it's easy to say that trainee year is essential for all physicians and for all fresh graduates.
Yes.
But what would you define as trainee year? Not just first year of medicine, but like, what is trainee year to you?
So, like, there are essential things that you pick up very early on in your career, like writing a good progress note, taking a good history, getting into the habit of examining your patients. If you miss these crucial details or these crucial skills, as simple as they may be, you will get into the bad habit of not seeing patients every day, or not writing a complete note, or not looking at all the labs on time, or ordering and forgetting, or not following up plans.
Right.
It's these habits, if you pick them up very early on in your career, it's just going to be automatic for you, and you don't have to, all of these essential skills you just carry on with you in the next year and the next year. And then when you go into the board as a resident, which I'm going to be in June, inshallah, I have all of these, these skills that I've gained as a trainee.
So would you say that trainee year, the main thing you want to take out of it is to build these basic skills? These
basic skills that you should already have. You want to, just build on them,
Mm-hmm.
make them a part of your fabric as a physician,
Yeah.
and just absorb everything around you. Just use that time, because you're a trainee at the end of the day.
Yeah.
No one really scolds you for any mistakes, or
True.
or they just, it's in the name.
Mm-hmm.
You're a trainee, so try and absorb as many experiences as you can. Learn from your mistakes.
Mm-hmm.
Be honest with yourself, and take constructive criticism.
Now, one thing, I'm not trying to demean my fellow trainees here, but I think it's fair to say this. It's very easy to sometimes fall into this feeling of like you're just a glorified secretary. Yeah. I mean, we wake up, we check the labs, we write a really good note. Well, we should be writing a really good note.
Yeah.
We're examining the patient, we're writing that down. We present it, and then they go, right, do A, B, C, D, E, stamp.
Okay.
You know?
But that's what you make it to be.
Okay.
Your trainee year is what you make it to be. In my medicine rotation, I was given the freedom to manage
True.
my patients.
Especially during the on-calls.
Especially
That's
during the
best time.
on-calls. Yeah,
Yeah.
obviously that's the best time you learn, because you're practically alone with the assistant, and if you're good enough, they leave you to manage patients alone.
True.
Not because they don't care or they're lazy. It's just because they're trying to give you your freedom, your workspace.
Yeah.
And I really, really did benefit from that. Even in rotations where, I don't want to be a surgeon, but during my surgery rotation, I was actively managing my patients.
Now, okay, this is not on topic with this, but I really want to ask, is it true that if you're in surgery, you got to tell them that you like surgery? It doesn't matter if you like or dislike.
I actually, the very first like sentence that came out of my mouth was, they asked me, they told me, are you interested in surgery? And I said, I've applied to internal medicine in Canada. I'm just waiting for my acceptance. And they didn't really care.
Okay, so they
That's a good thing. Yeah, they didn't
okay,
really
okay.
care.
That's good. That's good. That was one fear I've been having.
Just be honest with them, and they'll be fine with it. Don't worry.
And going throughout your trainee year, I wanted to ask you, was there any habits that you picked up that are like unique to you? I don't mean like, I study 5 hours a day, blah blah blah. I mean, is there any habits that helped you that you say that are kind of unique to yourself versus other people?
I wouldn't say something that makes me unique. I mean, every person has their own experience with their trainee year. I would say that the fact that I flipped my schedule around to compensate, as I said, taking 2 ICU electives before I apply in June, it was, I think, or July or something. Before that, I had to get my 2 ICU electives down so I can get recommendation letters. That experience in and of itself has put me through so much, work and experience that maybe that would set me aside from the other trainees. Other than that, it is what you make it to be. It's your own experience,
And in terms of like flipping your schedule around, who do you think? Okay, so it was a plus for you. Do you think there's people that it's not good for, like they shouldn't be doing this?
Again, it's just you and your goal. I mean, some people would think it's unnecessary that I even apply during my training year. Why would you? Most people wait until their assistants to apply. So why would you do that? I didn't want to wait, partly because I know that the fellowship that I may pursue in the future is going to take 7 to 8 years. Yeah, I want to be an interventional cardiologist is my plan A, and that takes at least 7 years, maybe even 8.
Wow.
So I was thinking, if I go abroad and it takes me 8 years, do I want to come back when I'm 34, 35, or when I'm 39? Like these 2 or 3 years to me made a big difference, or factored into my decision to apply early. There are other people who just don't care, and that's
fine.
They feel like, why should I put myself in unnecessary stress?
True. I mean, that's another thing is, what would you say? Oh my God, this coffee is just spilling all over the place. You know what? Hold on. Clean this
You
up.
can edit that out, right?
Oh no, we'll keep it. It's fine. It keeps it juicy. Keeps it fresh. For those of you who are just listening to the audio, my coffee is literally spilling every time I'm drinking it, and it's annoying me that it's messing up the table. So there we go. I'm gonna hide the tissue from the shot though. Okay, so getting back on track here. What would you define though as a negative trainee experience?
If you slack off, you're not gonna, you're not gonna be let off the hook. And there are some people who end up repeating, 2 weeks.
Now, do you think that in Kuwait we have a sufficient system in place to kind of catch people that, let's say, they're not doing well as trainees?
Yeah.
Do you think we have a good?
Yes.
Okay.
Yes.
Yeah.
The attendings, the seniors, the consultants, they all ask every day. And you said it. We present during the rounds. We're the ones presenting the cases. We're the ones writing the notes. We're the ones following the plan, or we're the ones who are expected to follow the plans.
That's another thing. I sometimes wonder what makes a good trainee, because there was a lot of times, I think for me as a trainee, I've been very confused as to whether am I doing this okay? And then sometimes you'll hear the opposite. You think you're doing something badly, then they're like, no, you're doing well. And then you do something well, and then a month later they're like, oh no, you were horrible.
Then again, if you're struggling or if you feel like you're lost, that's the moment where you learn the most.
But then what do you think is the role of your assistant in having a positive trainee year?
You mean as a trainee, what a good assistant would...
Yeah.
They're there to guide us. And if you have a good assistant, your rotation is going to be very smooth.
Do you think that a good assistant is essential in building the core skills of a trainee?
Yes. The assistant that was with me in my medicine year who ended up being a very close friend of mine is the one who actually taught me many things in the beginning of my rotation. And they're not only there to teach you just the basic skills, they're also there to give you, like a safety net. I'm going to make a set decision. What do you think? They're going to say, go ahead.
Yeah.
I'm there if you need anything, Like if there's a critical case in an on-call.
Yeah.
And you go there, you do your assessment, you call the assistant, you tell them, I want to do this. And they give you the green light. Because at the end of the day, as I said previously, trainees, they get scolded for negligence. But if you make an honest mistake, no one's gonna. It's not you who's gonna face a consequence. It's the person directly responsible for you, who's the assistant. Like if a trainee makes a mistake in an on-call, they don't get the blame for it.
I mean, I feel like it's important to bear in mind that us trainees, we're gonna be assistants next year.
Exactly.
And one thing that I like to think about is, what are the things that I need? What do I like? What do I, what feedback would I like? And then next year I want to take that forward as an assistant.
Yeah, so you have to listen to constructive criticism, take it on the chin, learn from your mistakes, and also try to help others. Like if you've been in a rotation for a month and they have a new trainee in that rotation, help them.
Okay.
It takes, it's going to take you a long way.
When I was talking to Dr Mohamed Al-Fadhalah about team and whatever, she says that one of the most essential things is also the team that you're in.
Yeah.
And that relationship, that bond.
Yeah, that team dynamic is everything. It gets, if you have potential, it's a good team dynamic is going to bring out that potential no matter what, no matter how difficult the rotation is, no matter how many people you are, no matter how complex the cases can get. If you have a good team dynamic, it's going to be smooth sailing.
And what was the most useful rotation for you?
Oh, medicine, obviously.
Okay, why?
Obviously. Because it's the only rotation I feel where you're given as much freedom as you can handle.
Okay.
If you're a serious trainee and you show them that you have not just, I'm not saying that you have a lot of knowledge, but you have, basic skills, basic knowledge, just enough independence, honesty, just a good work ethic, they're going to give you as much freedom as you want. So, as I said, during the on-calls, if there was a critical case, I would, after the first month, I was seeing them alone.
Okay.
That was nerve-wracking for me, but how else are you going to learn?
And as a trainee, one thing that this is my personal philosophy, I don't know if this applies for everyone, but I've always had this thing of like, I trust the process. So like, I know that there's going to be a lot of times that I make, honestly, a fool of myself. I don't know if I ever told you this story. I was with my senior, and he was just, asking me a question about on-call. He was just trying to quiz me a little bit. Patient is calling you about, the patient is desatting. What do you do? And I think you recall, like, I spoke to you about this earlier, and we talked about it. I answered correctly. I even handled the patient correctly. Then I went to my senior, and I said the exact opposite of what I just did, like an hour ago.
That's fine.
That's my question. Is it fine?
Yes, it is. You get nervous, so what?
But my thing is like, I know a lot of trainees that they just get so worried about looking good.
Their image?
Yeah, their image.
Okay. You're right to an extent that it may sometimes reflect poorly on you if you answer incorrectly or whatever. But the only validation you need is from your patients at the end of the day.
Okay.
That's literally the only thing that matters. If you treat someone or you see someone every day, you don't have to be actively managing them. I'm not saying you put the entire MR12 by yourself. But if you're the one who's seeing them every day, you're trying to actively manage, you're trying to communicate effectively, effective communication. That's the single most important. The way you speak to your patient, the way you listen to your patient is the single most important thing. Okay. If you can do that very early on, you're going to be an amazing physician, no matter what your specialty is. So if you get if at the end before their discharge, they say thank you, or they remember you, or they even يدعون لك.
It's such a good feeling.
That's literally the only thing that matters, because you're just temporarily there. If your senior doesn't like you, if your consultant doesn't see you as a good trainee or whatever, doesn't matter.
Yeah.
So what?
Yeah, I mean, true.
Yeah, you're just there for 4 months and then you're gone.
Question though, do you think that this image, I think one thing that I've been worried about is if this image continues for the rest of your life. So like, let's say you're a horrible trainee. Let's say you're just the worst. You pick up your act, you hit the books, you're great. Okay. Now you're the best doctor, okay? Yeah. But do you think that one day, like 20 years in the future, you're always going to be like, you have your clinic and then they're just like, I knew that guy, he was horrible, don't go to him.
I don't think so.
Really?
I don't think so. Yeah, because we all, progress at some point. If we're working hard, we have to progress at some point. So in 20 years' time, if you were a poor trainee, the consultant isn't going to be like, oh yeah, I remember him. He was a horrible trainee. Yeah. Because then again, at the end of the day, the only thing that matters is your patient's outcome and what they think of you.
Now, what do you think, in terms of consultants judging us, what do you think about the consultants there are some consultants that scold a lot, some that don't scold a lot. What do you think? It's a good thing, a bad thing?
They're all unique in their own way. I personally it never really bothered me if there was a really difficult consultant. It's the way that I approached it was, if there was someone obstructing me, or if there's someone in front of me and they're not, obviously, it's not on purpose, it's just the way that they are.
Yeah.
They're not just difficult with me, they're difficult with everyone. So I try not to go through them.
What do you mean?
I mean, I don't face them, I don't take it personally. Because where's that going to get me? At the end of the day, there's an evaluation. So I try to find a way to go around them. I avoid interactions where I can. Unnecessary interactions. I keep my head down, fly under the radar, and then I just, make it out of there.
But what would you advise for trainees that let's say they disagree with the management plan.
There's actually a well-working system for that. It's standard everywhere.
Okay.
You respectfully approach them. That's the first
Underline
thing.
respectfully.
Respectfully approach them.
Who, the consultant?
Yes.
Okay.
If whoever's doing the round, basically.
Sure.
You don't want to go to someone else. Like if consultant A put a plan that you don't agree with, you don't want to go to consultant B and tell them, hey, consultant A.
Mm-hmm.
Because then that's hearsay.
Okay.
They don't.
Yeah.
It just doesn't look well.
Yeah.
So what you do is, first of all, understand that they're a consultant, so they have at least 20 years of experience under their belt. So I'm not going to say there has to be something, but maybe 7 or 8 times out of 10, there's something that you don't see.
Yeah.
So you search it, you open your resources up to date or whatever you use. You make sure before you go, and you respectfully speak with them and try to, when you open that conversation, put it in question form, like you're inquiring about it. Well, I read that that's not the way that you do it. What do you think? And if they agree, then they agree. But if they don't agree, as long as the patient's safety is not compromised.
Yeah.
So if they're giving the wrong medication, then you escalate.
True.
If they don't listen the first time, I mean.
Now, across the specialties, in your experience, are consultants generally good about hearing this, or not necessarily always?
Actually, yes.
Okay.
And especially in medicine.
Well, this is a good reflection of kind of the culture of Kuwait in terms of medicine.
Yeah.
Because, I forgot where I was reading this, but like back in the 70s, 80s, the hierarchy system in medicine is, not in Kuwait. I was reading this about like the States. The hierarchy system really impeded communication,
Oh, yeah. Yeah, I agree. There is still a hierarchy system here, and you have to, at the end of the day, consultants' orders or seniors' orders or whatever's orders, whoever's orders, they have to be implemented. But if you disagree, you can have a respectful, open conversation with them, and you actually might learn something out of it.
And the hierarchy system is a good thing as well. Yeah. I mean, it protects us.
Yeah. Obviously, yeah.
Yeah.
You're labeled trainee for a reason.
What do you think of the label, though?
There's nothing wrong with it.
I don't like the word trainee.
Why?
I'm training to be a doctor? I thought that was med school.
No, you're training in a system. It's a system at the end of the day.
Yeah, I guess.
So
I like it. Intern sounds like. Or no. I'll tell you my favorite one. Either foundation doctor, the UK, so I'm a little bit biased. Okay. That's where I learned. Foundation or junior doctor.
Yeah, I mean, junior is the umbrella term for assistant, and assistant.
Just do not call me baby doctor.
No, no one's a baby doctor, really.
My own mother has called me a baby doctor several times. And she's like, so do you prescribe medicine? I'm like,
yeah. There are certain things you can't prescribe as a trainee.
True.
Like narcotics, for example.
True. Now, one thing before I got into trainee year that I was advised a lot about, and I'd love to hear your take on this. There was a lot of, and if I have to collate all the advice that I got, there was a lot of advice I got about the social side. And to be honest, it sounds extremely toxic. I'm not going to lie. This was, again, this could be wrong. I have not felt this, okay? But there was a lot of talk of, don't tell anybody you're doing this research. Don't tell anyone you're doing that. Be careful who you speak with, blah, blah, blah. Do you think that it's not actually that deep? Like, we need to just calm down a little? Yeah.
Definitely.
Okay.
Yeah, I haven't faced that. I was open about my goals. I was, I told everyone that I'm applying. I told everyone my Canadian score. It wasn't a secret, So I didn't really feel that. And again, it depends on who you make friends with.
But do you think that the social kind of environment of Kuwait for medicine, blah, blah, do you think it's very welcoming? Do you think it's
Yes, definitely.
Okay.
Definitely. Because it's in our culture anyways to be, affable and approachable and friendly, and working together is just you know, it applies within the domains of the hospital and outside.
I mean, this is a good thing that you're mentioning this, because honestly, I've heard it. It's not from one person that I've heard this, by the way, but there's a lot of people that I've spoken to where there was a lot of this, like, they made it very Machiavellian, the way that people, operated in Kuwait. It made me concerned a little bit. I was like, guys, it's fine.
Maybe it's because I was too busy working on myself that I didn't really pay attention to it. But
this is an Instagram quote right now, by the way. It's in black and white. Motivational music playing in the background.
I didn't have time to think about these things, you know. So I graduate, I study, I took the exam, did well, and then I had to focus on gathering all of the recommendation letters.
Well, you know, one thing that people did say, like on a social level in Kuwait, and that I've heard from a few places, is especially as foreign graduates, they said, oh, you know, people in KU, they got their name out there, as in like who they are and in the medicine world, blah blah blah, and they've done this for many years because they've been here, you know, sowing their seeds. We've been abroad, we come back, nobody knows our face, and this puts you at a disadvantage.
No, it doesn't. No, when we all graduate and we come back as interns, then we're all the same level. Okay. There's no such thing as who am I? I was just a medical student back then.
Now, do you think that the same applies for like residency, in terms of like you go off and, you know, maybe people who did their boards in Kuwait have advantage on let's call it like at some career networking blah blah level, you know?
Oh yeah, that you could say that there is some truth in that
for residency.
I mean, obviously they've been here for like 5-6 years working, so people obviously know them more than someone who's been abroad for 7 or 8 years and then coming back. But I'm willing to you know, to take that or to accept that disadvantage, if you will, if you see it as a disadvantage, because I don't. Because when you come back or when you finish your board, whether you're in Kuwait or abroad, your work speaks for itself. Yeah. If all you care about in the end is your patient's well-being and their comfort and communication, as I said, communication is key. I've heard about this a lot, and I've seen it in real life as a practicing physician. They don't really care about the knowledge that you have in here. They just want someone to listen to them and to alleviate their concerns. Yeah. And to be honest with them. Like, I've seen people who are very, you know, concerned, if you will, or very confused, or very angry that they don't know what's wrong with them, or they're labeled as difficult patients. And all I had to do was listen. And then they saw me as, you know, a good doctor, or someone that they want to treat them or see them every day, just by listening.
I mean, that was for me one of the things coming into trainee year, was actually accepting that I now answer the questions. And that's a huge responsibility.
Yeah. So if you don't know something, just say you don't know.
You don't know, yeah. I still remember the amount of times where, because in med school, I always was it was almost rehearsed now, that a patient would ask me a question. I'd be like, well, doctor, this can answer your question for you, and they'll come back.
There's absolutely nothing wrong with that. There's absolutely nothing wrong with that.
But the amount of times where, in the start of trainee year, where they would ask me something, I'm like,
it's fine.
Oh, it's me.
It's fine.
I got caught off guard, you know?
They'll actually respect you more if you acknowledge your limits.
Okay.
If I tell them this is not my area of expertise, like if they ask me an ENT question about a tracheostomy, can I downsize I don't know. Let me call the ENT team.
I'll be honest though, nothing kills me more when they do this move, and then they proceed with the
same question again. I don't blame them sometimes, you know.
No, it's true. Like, we are seeing, like, we were talking about this with Media. We're seeing patients at their worst. Yeah. And their families at their worst.
So you're seeing, it's probably one of the worst days of their lives. The way you act and the way you speak with them and the choice of words is either going to set a really good impression and they're not going to forget you, or it's going to be, you're going to make their experience even worse, and they're not going to forget you for the wrong reasons.
Yeah.
You don't want that.
And not to mention that, like, I think this is at least my opinion. Somehow, another doctor is also going to be annoyed with you, because the amount of times where a patient has been like, "Oh, but this doctor said this," and I'm like,
yeah, it's fine.
It's wrong. Don't, you know.
That's fine. Yeah. See, about that, I don't shame other doctors.
Oh, okay.
If there's something I feel was said that was wrong, I don't call them out.
Okay. But
I
then,
just
okay,
try and explain that, well, that's not how I do it, for example, or there's a better way.
But what do you do when it's sometimes something is factually wrong? Because I've been in the place where a patient tells me, doctor said X, and it was a falsehood. There was nothing true about it. And usually, like, I remember this was maybe 3 months into my medicine rotation. And up until that point, I do a lot of like, oh, well, this is from our experience, blah, 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 blah. But I remember I had this point that someone said, this doctor said this. And it was a family that was very, they were a little bit difficult in the sense that they had a lot of medical mistrust. And so I remember I just had to be firm and just be like, that is factually incorrect. I'm sorry. And I'm assuming that they understood maybe wrong due to maybe communication error or whatever.
Yeah, because you don't know.
Yeah.
And anyone can tell you. Anyone can come up to me and tell me, Dr. Aziz said this.
Yeah. And
how do I know that you actually said that? Yeah, exactly. Because it depends on how you explain it to them. You can say something and they can take it for something else.
Yeah.
So you always have to be mindful, because it'll reflect really poorly on you.
Actually, I remember we had this one patient who they wanted to go on a llama, so they wanted to leave against medical advice. And we kept explaining to them the risks of that. And we kept explaining that if you leave, you're going to have to go through the ER again. We cannot bring you back to your room, for example. They were like, yes, absolutely. I'm ready to sign. 3 hours later, they came back and they're like, excuse me, where's my room? After they signed and they left, they fully left.
Yeah, there's nothing you can do about that.
Yeah.
You told them and they didn't listen.
Yeah, like what?
Yeah, exactly.
They kept blaming this one poor doctor. They were just like, he said this to me. I was like, no, I was in the room. No, please, don't go after him.
It's fine. Some patients can be difficult in terms of compliance. And again, if you want to maximize their compliance, then you just have to be, an active listener.
Yeah.
And like sometimes I'll give you an example. My very, very first patient as an intern, he was a 93-year-old who came in with myoclonic jerks.
Okay.
And we wanted to start Kepra for him. And his daughter refused.
Okay. Was
so
he
they
compos mentis or? And was he?
No. He was. Yeah. He could. He didn't have capacity.
Capacity. Oh my God.
Yeah,
competent.
He didn't have the mental capacity to make his own decisions. So his daughter was the decision maker for him.
Right.
They made her sign refusal, and I went. I said to myself, let me try at least. I want to understand why she's refusing potentially life-saving medication for her father. I mean, no daughter wants any harm for her father. No. So I went in and I listened to her, and she was into allopathic alternative medicine. So I listened to all of her concerns. I remember staying for like an hour.
Okay.
And then after listening to her background and her point of view, I had my rebuttal tailored to her situation and her background. Right. So I brought it to her perspective or her level of understanding, and she accepted.
Really?
So if someone is being difficult, or if someone is getting angry or refusing something, always try to look for the root cause. What do you understand from what I'm telling you?
And as trainees, we're dealing with a lot of that. It's not necessarily just on the consultants or the regs or the seniors.
Yeah, exactly. So you have to try and get these skills under your belt early on, and it takes you a really long way. Even if they refuse, they'll respect you.
Now, one thing about trainee year is that this is, you know, these experiences are all stressful. They're really stressful.
Yes.
How did you keep motivated? Was there anything? Did you have sources of inspiration, or like I don't know, a podcast, a book? Is there anything that, you know, if you had a younger cousin who's coming into medicine, you're like, you know what, get this, and this will help you push through?
The team.
Ah.
Yeah. I had amazing team members. So
Okay.
when I have a difficult experience, I would go into the office and I would sit down and I would speak with them. And they were so supportive of me, and they would listen to me, and they would, you know, just make things easier. If you're, as I said, if you're in a team with a good dynamic, doesn't matter what comes at you.
Should you be friends with your team?
Yes, definitely.
Okay.
Definitely.
Yeah.
Yeah, I don't understand people who say keep your work and social life separate.
Oh, okay. Let's touch up on that for a second, because this does kind of go contrary to, you know, like what other, like some of the advice that I've heard as well.
Which is,
You know, work is work. The second you clock out, you're done. That's not the two don't mix. They're not your friends. They're not anything.
Yeah.
I don't agree with it. I'm just saying that this is something that I've heard.
I mean, if I have a really bad experience, and sometimes we deal with life and death, and an on-call, let's say, even in our day-to-day work, and someone was there to help me, like someone, like an assistant or a fellow trainee or whatever, and they were there with me the whole time, and we go through that experience together. How can I not call them a friend, basically?
Yeah.
You know, because we have to sometimes break some of the boundaries to help each other.
Yeah.
So I don't understand that. And you have to separate your work and your social life. I mean, I have two phones.
Yeah.
But that's because I don't want the words calling me on my on my main phone.
Well, that actually, side question. Do you think, in terms of maximizing trainee and whatever, two phones?
Definitely two phones.
Thank you. You know how much people made fun of me?
No, you have to.
Shout
have
out to my Manchester friends who graduated with me and all made fun of me.
No, you have to have two phones.
Thank
because you're WhatsApp with your friends in a group, and then the word call you, or the unit group are sending messages or asking questions outside of, you know, on like a weekend or something.
Yeah.
It's your right not to
answer.
Yeah, it's fine. It's your off time.
Yeah.
So my off time's my off time.
Yeah, I've lost my, actually just this weekend I dropped my phone in the car, and I forgot about it all weekend.
That's fine. Because outside of working hours, you're not responsible for what happens.
Yeah.
I mean, otherwise, we'd all just be burned out.
Yeah. Now, one thing that I also wanted to get into was defining a good trainee. Okay, we touched up on it a little bit, but in terms of personal characteristics of, I think it's fair to say that everybody should be focusing on self-development. We always need to grow as people in general. So what would you say are some characteristics that we should be trying to aspire for as trainees?
That developing a good work ethic, developing your own system for yourself, something that you're comfortable working with on a day-to-day basis, knowing what you want to do is also like actively seeking your interests. Okay. For example, I took one ICU elective, and then I went ahead and did another. And some people were saying, why would you do that to yourself? It's too much work. It's, too stressful for a trainee. Yeah. It's an interest that I developed. So from that, I've got intubation skills, central line fixation, ventilator settings. All of these things I got. I didn't even finish the first half of my training year. So because I was actively seeking my interests, I gained skills that I never thought I would gain at such an early stage of my career. And the most important skill or attribute that you have to have in order to be a quote-unquote good trainee is self-reflection. Self-reflection. Just be honest with yourself. You have to know your limits. once you set those boundaries, once you know that I don't know about this disease, or I need to work on my NGT skills, or I need to, whatever, a limit that you see in yourself. Once you set that limit, one, you're not gonna, harm anyone, obviously, and two, you're gonna gain the respect of those around you.
Okay.
Don't think that if you don't know something, then they're gonna see you as, not up to par with them, or not.
Really?
No, don't, because you're still learning.
So what would you say to people that do judge?
You shouldn't really care about others' opinions, because once I figured out that my patient's view of me is the only thing that matters, you just forget everything else. So what? Whoever, the senior doesn't think that I'm up to level, who cares? If my patient is thanking me at the end of the day.
Your patient is the priority.
They're obviously the priority. Why do you go to work every day at 7:30?
True.
What drives you to be working hard every day? Why did you go into medicine in the first place?
Well, in terms of burnout, one of the things that I feel like when physicians get burnt out, they lose sight of what they're doing with patients and stuff, and that's one of the recipes. They get this.
It's a real thing. Burnout is a real thing, and it happens to so many people.
You think it can happen to trainees, or not too early?
Of course, they're the most vulnerable, anyways.
This is okay. That's actually a really interesting point. What do you mean?
When you just start out, and you're being put under so much pressure. At times, obviously, it's not. I don't want to scare anyone, but if at times you're put under so much pressure, you're not used to that workload.
Yeah.
You didn't develop that mental stamina yet.
Yeah.
Or that physical stamina.
Yeah.
I'll give you an example. My first 2 weeks, I was sleeping maybe 14 hours, 15 hours a day trying to compensate. Because I wasn't used to it.
I had the same issue.
Yeah, everyone does. And then well into my trainee year, I can pull off 36 hours. 36 hours. And I'm fine.
Yeah.
When I go home, I just
crash.
Yeah. But especially in the beginning, because you didn't really develop that capacity yet.
Yeah.
That's where burnout can hit you.
That's actually really cool that you mentioned this, because for me, I always think burnout is it's a time thing. Burnout happens like
I disagree.
Yeah.
The more experience
that actually, that's true though.
It can hit anyone, obviously, but generally speaking, especially in medicine, the older you grow, or the higher up the ladder, the less time at work you put in. Like a consultant isn't with you in the hospital during the on-calls.
Yeah.
They just come and do their evening round and go home.
Now, in terms of burnout for trainees, we don't technically get vacation, right?
Or you do. After the first 6 months, you have like a month.
Wait, what?
You can take a month off. You didn't know that?
No.
After the first 6 months.
Sorry, you're capturing a live reaction here. This made me really happy. I got strapped in for a year.
I took 26 days off.
What?
Yeah, I took 26 days.
Okay, what about the 6 months after that?
The first 6 months, you're not allowed to take a vacation.
Sure.
It's unpaid leave.
Hello. Fine.
After the first 6 months, you're free to do what you want.
Okay, and then how much vacation do we get? Like, what's our,
it's
within a
days.
year?
30 days. You're not allowed to take more than 2 weeks off in a single rotation.
Okay.
And you have to complete, I think it was like 2/3 if it's a month, like pediatrics or OBGYN. You have to, your maximum is 1 week. So what I did was I took the last 2 weeks off of surgery.
Okay.
And then I just continued until I completed 26 days. Then I started my next rotation. So I took time in between. So no one told me I couldn't do that.
Now, give me some advice on this. In terms of vacation time, do you recommend people using that time to go for electives, or there's this you're balancing between two things. On one hand, you want to rest. I think if you don't rest, you're not going to be able to function.
You have to rest.
But then at the same time, if you want to go off to, for example, the States, they do like that clinical experience there.
I already took 2 electives at the time,
Mm-hmm.
so I wouldn't say that I was, I felt inclined to take an elective in my month off,
Mm-hmm.
but you have to take a proper vacation annually.
Okay.
It's essential because when I came back, I felt refreshed
Mm-hmm.
and I was ready to, start again. So vacations are a must. Proper vacations
But
are a must.
What about COVID doctors like myself who all their electives got cancelled because of...
You can take them in your training year. It's fine. I mean, I took many electives
Mm-hmm.
and back in medical school. I didn't mention them in my CV. I only mentioned that I took 2 ICU electives, by the way.
Do you think, from what you've heard, does that apply for also the States, UK, wherever, or is that...
I think it applies to the others. I mean, what's different from... What sets them apart from Canada? They're all,
Within the same network.
within the same standards, if you will.
Yeah.
Yeah, I just put my electives and my CV was only 2.
Mm-hmm. Now, I want to take a quick pause here.
Yeah.
And then when we come back, I do want to talk about just making the best out of trainee year, the clinical side, the CV, the applications, all of that. So we're just going to take a quick pause. You guys listening are not going to feel it, but for us, we're going to feel it right now. Be right back. And we're back. So, getting back into trainee year, making the best out of it. I wanted to break down into like 3 areas, like how to make the best out of these 3 areas for trainees. Number 1 is clinically, like how do we make ourselves a better doctor? Does that include changing the schedule? Does that include seeking out certain programs? I don't know. Next is our CV, how best to build our CV during trainee year. And then the last thing is our applications, like exams, et cetera, et cetera.
Okay. So you want to start with the
Clinically, yeah.
Okay, so it's best to start off by binding yourself to the medical ethics.
Okay.
We read them and we understand them in theory, but when you are practicing every day, it takes you a very long way when you apply them.
Okay.
Try to be self-aware of the limits and the boundaries. Try to be patient-centered. Always try to involve your patients in the decisions that you make.
Okay.
They have to know what their diagnosis is. Ask them. تعرف أنت شنو تشخيصك?
That's
You'd be surprised. Some of them don't actually.
In my experience in Kuwait growing up, and I remember feeling this in med school, I was like, I have no idea what illnesses I have had in my life.
You don't know. Some people don't really know, or it's not really.
I've not been told.
Explained to them in layman terms.
Yeah, I mean, I once ASK. Remember I don't know if you graduated at this point, but we had a service trip to Vietnam.
I wasn't there.
No, yeah, so NHS service trip to Vietnam. We helped build a house for in a rural community. We helped build a house. Anyways, once we finished doing that, and it was time for a little bit of sightseeing, a little bit of cultural exploration, I got sick, fever, everything. I was totally out of it. Like 10 days of my life, I don't know what was happening. In and out, in and out. And then I came to Kuwait. I just remember they're like, okay, come here. And then they gave me nebulization, blah, 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 for like a week. Nobody warned me that salbutamol was going to make me pass out. So, like, like shaky, whatever.
Shaky.
I'd get to the car, and I'm just like, oh no, what's happening? There's an example, yeah.
Try to let them know what they have. Tell them how you're going to treat them.
Yeah.
Explain the possible side effects. What they should expect from their hospital stay.
Right.
And always discuss the goals of management.
Oh, okay.
If someone is really sick,
okay,
how far do you want to go with management? If someone is 98 with meds, do they want to be, do they want the whole, full active, as they say? It's their right. It's their right what you put in their body.
Yeah.
What medications you give, oral, IV, NGT, intubation, all of it. And if they refuse, then you have to make sure that they have the mental capacity. And if they make an informed refusal, then that's out of your hands. So that's one thing that you have to keep in mind. And it takes practice.
Mm-hmm.
You're not going to be an expert in the beginning.
Mm-hmm.
It's going to take some time.
Mm-hmm.
That's one part. Another part is read around your patient.
What do you mean?
If you diagnosed someone with, like last month we diagnosed someone with neurocysticercosis. That
was a bit of a long word for me.
It's basically a parasite.
Need more coffee.
It was in the brain. It was in his brain. And I didn't really know the management exactly, other than albendazole. I knew it in theory, but there were some things that, you had to do, dosages to get right, giving steroids beforehand, like one day beforehand. I didn't know that. So I went home and I read around my patient.
And I'll tell you, there's no better feeling than when, there was a case of a patient with, wow, I'm really failing to prove my point here, but pituitary apoplexy.
Yeah.
There we go. There's no better feeling than when you actually see it on the ward, and then you go home and then you read about it, and it pops. Oh my God! When it pops up in a New World question, and you get it right, no greater satisfaction.
It sticks.
Yeah.
It sticks, and it sticks for a very long time.
Mm-hmm.
That's how you build proper experience, as they say.
Now, would you say that, with a trainee year, you just trust the process and you're going to get all the clinical knowledge you need, or it's like, no, you got to be very conscious?
No, be conscious all the time.
Okay.
And be wary of the steps that you take, and understand that what you do now is going to benefit you later, in the long run, or hinder you in the long run.
True.
If you decide to be, negligent, it's not going to be good for you. Forget about the evaluation. These are all material things. I'm talking about the future.
Yeah.
As you progress further.
Your practice.
It's just, it goes the same with everything. It's not just medicine, but it's extra important for us because the outcomes have to,
Higher stakes.
Higher stakes. We are dealing with human beings at the end. And obviously, not all specialties deal with life and death. But, prescribing the wrong medication can do harm,
Yeah.
or not knowing the side effects of something. That's something else I wanted to talk about. When you're clerking and you read like 15 medications, there are some things that you obviously would not know because we use brand names here.
Yeah.
Search them. Yeah. Search the side effects.
Yeah.
That really helps you, and it helps solidify that information in your head. Medication interaction, and it's called medication reconciliation. Do that.
Yeah.
Don't write something. Don't be, as you said in the beginning, where secretaries, right? That's what
glorified secretaries.
Yeah, glorified secretaries. Yeah. It's just read about these medications before you write them on the prescription. One, you might avoid a mistake.
Right.
It could be a near miss.
Yeah.
Okay. True. And two, you're gonna benefit yourself in the long run. And as I said, it's just gonna stick with you.
And if I can add on to that, I've actually been in places where I've caught, I'll be honest, small errors, but errors.
Yeah.
In medication.
Because we're all human at the end. Like if someone is in the casualty, it gets really busy.
Yeah.
That's a fear of mine.
Yeah. As
when I'm down in the casualty and it's a really busy service, and I have 4 or 5 pending cases that I have to see. Some of them are really sick. Yeah. I don't have the luxury of really reflecting or taking my time on some of the cases. I'll try my best to strike a balance between making extra sure that I'm not harming the patient. This is the proper diagnosis, that's the treatment.
But you got to get the job done.
I got to get the job done, and there's a time frame for me, because if I take such a long time on one case, then there are other cases that might not be, get the proper care that they need. And that's the same here. It goes the same everywhere else in the world.
Yeah.
The hospitals are always busy.
Yeah.
So that's why a trainee has to make sure that when they receive the patient in the ward, they take a proper history again.
Yeah.
They do their clerking right. They search the medications that they're prescribing, because it's your stamp.
Yeah.
And then it's a win-win for everyone. You get to learn. The patient benefits from proper care. And if an error was caught in the ward, or if something was missed, the person who was down in the ED is also going to benefit.
Yeah.
So that's, from a clinical point of view, that's how I'd say you can maximize your trainee year.
And if I could actually add on like one of my own, from my experience, whenever I went on a ward call for on-call specifically, I looked that up, what I was doing.
Yeah.
And it got tedious eventually, like hyperkalemia, how to manage that kind of stuff.
Just read. Just read it. It just doesn't take 5 minutes.
It really doesn't. No, it doesn't need to be a full
don't
textbook
read the whole up-to-date article. But like, look at the relevant things, scan through them. It's gonna stick.
It really does. And like I said, besides being confident in the on-calls, whatever, trust me, multiple choice questions when you get them right because of it. Such a rush. Sorry. So okay, clinically, that's how we expand. Cool.
Yeah.
CV.
Okay, so I've been personally building my CV ever since I was in medical school. I've taken part in, student activities, student elections, medical student association, stuff like that. So in that sense, I wasn't really struggling in my trainee year to gather things for my CV. However, there are ample opportunities for an intern to build their CV while they're doing their trainee year.
But one thing though is that I know a lot of people, myself included, you get overwhelmed a little bit by the job, and then you want to take some time to focus on, I want to study for my exams, do the job.
Okay.
And then as you're focusing on that, you're like, oh my God, now I'm guilty. Why? Because my CV, I'm lacking. I need more research. I need this.
First of all, it depends on the specialty that you want.
Okay.
If you want to get into a really competitive specialty, odds are you've been eyeing that specialty for many years.
Sure.
So by that time, you should have done your job. And you should have taken dermatology electives, for example.
Yeah.
Done ample research and worked hard enough to build something that's required for, let's say, for example, a competitive residency like plastic surgery or dermatology, where there are limited seats and everyone wants, there are lots of applicants. But if you're going into like internal medicine, for example, it's not really, a really solid CV is not mandatory. When I say solid, I don't mean don't go to conferences, don't do voluntary. I mean like, doesn't have to be 15 pages.
Yeah. Okay.
By the way, when you apply, in the description
in Canada for Canada.
Okay. When I applied, I had to cut my CV down around 10 pages.
Really?
They wanted maximum 4 pages, so I just put down the most reflective, biggest achievements that I've made on my CV.
Right.
And the most important thing is, when you write up your CV, try and build a CV that reflects you as a person.
Okay.
For example, I really enjoyed getting to know international students. I was really multicultural back then. Back in school.
Or?
Back in school.
Okay, back in school.
I've even lived abroad for some time of my life. Yeah.
Where?
I lived in Egypt and I lived in Bahrain.
Very cool. Okay.
And I had a few spells in the United States when I was a kid. So.
Oh, where in the States?
Seattle.
Okay.
I was in Seattle for a while.
So you didn't like the sun, huh?
Yeah, that's why I'm going to Vancouver now. Actually, it's like an hour away by car. Anyways, so I was really into being multicultural.
Okay.
Or understanding different cultures, trying to be as diverse as possible. I didn't really get that from Kuwait University because it's a public university. So when I found out that there was something called the International Federation of Medical Students Associations, which is called, or the acronym is IFMSA. Have you heard of the IFMSA?
No, this is new. What?
It's like this, it's like the UN for medical schools.
No way.
Yeah.
This is cool. Okay.
And
why don't we talk about this? What?
Yeah, they gather like 2 general assemblies.
Okay, cool.
And there's a regional assembly every year.
Very cool. Okay.
There's like a Middle Eastern regional assembly and North Africa, and then there's a general assembly for all the world. Like over 120 countries or something. They all gather for a general assembly.
Very cool.
And it's divided into, the professional exchange, which is like signing bilateral contracts to send students abroad for electives. Like I've signed with Japan, for example. Yeah. So,
okay, well, any medical students listening, this is something I really wish I heard of.
Yeah, we had that opportunity. So I
That's
got to
so
represent. I got to represent Kuwait. I've led a delegation in Egypt. We went.
This
to
is
Egypt.
actually like the like MUN. This reminds me of MUN in high school.
And by the way, the drafts that are written,
Same format?
they go to the World Health Organization table.
No way.
Yeah.
Dude, this is really cool.
It
Do
was an
we have
amazing
something
experience.
for like doctors? Like juniors?
Yeah, yeah.
Really?
You can be part of the IFMSA.
Even, but I'm a doctor.
That's fine. There are
Really,
people on the
huh?
board of the IFMSA who are doctors, practicing
This is definitely
physicians.
something I'm going to look into because that's really cool.
Yeah, it was really fun. And
Awesome.
because I'm like that, I really enjoyed it.
Mm-hmm.
I've had, I've done some other things that I'm proud of, or I want someone to read in my CV.
Mm-hmm.
But I put that instead
Right.
because it said that about me. When I was going to interview,
Right.
they get an idea of
Who you are.
who I am.
Okay.
You know, so try and make your CV as relevant to you as possible.
Mm-hmm.
If you're going into internal medicine and you went to a conference for mental health, let's say,
Mm-hmm.
okay, don't let people fool you or tell you that you should only put things that are relevant to internal medicine.
Okay.
Maybe I'm an advocate for mental health.
Yeah.
I want that to be known. So make sure that your CV has all of the things that you want to be known about you.
Okay.
Doesn't matter if it's a flashy, huge achievement or if it's something minor. At the end of the day, it's yours.
But
So
do you
make it
think
yours.
the pressure of building that CV during intern year is real?
Absolutely no. There shouldn't be any pressure
Okay.
because it's unique. Everyone has a different CV. There are no set standards, by the way.
Okay.
So when someone applies,
Mm-hmm.
we don't even know what the standards are. When you
okay.
apply, it's so weird. When you apply, you think, for example, someone got a higher score than me on the Canadian exam.
Mm.
So you'd think that they'd get an interview, right?
Right.
Yeah. For example, I'm just
Yeah,
saying,
yeah,
for
yeah.
example, I get an interview and they don't.
Mm.
Even though
And that
I'm
happens.
convinced that they're better than me in 1, 2, 3, 4, 5.
Right.
You don't know. So make it about yourself and just put all the effort that you possibly can. Be the best version of yourself and apply.
And what would you say for people that extend out the time before, like they take a lot of time before applying for a residency because they want to do the exams, CV, whatever. They just want to take their time. Good
That's
idea
fine.
or bad idea?
That's fine. It depends on you.
Okay.
It really depends on you. My only the only thing that I had to work on was my exam because, as I told you, I was ready when I graduated. I already had my CV in place, and like for example, I'm not heavy on research. I wasn't really interested in research.
Right.
So I had a few things about research or under the research category that I've done. I didn't really put them on my CV.
Oh, really?
Yeah.
Interesting.
I had like something that had to do with pediatrics. I was a data collector, and I had my community medicine project, research project, that was not published.
Yeah, do they care about things that are not published or no?
Depends again on the special. Internal medicine is not research is not a requirement.
Okay.
So I'm sure like the really competitive specialties,
Probably, yeah.
they could, like ophthalmology, I'm sure that it does weigh in. But for me, it wasn't really a factor, and I use that to my advantage because I was asked, by the way.
Right.
They told me,
Why not? Or
why is your CV lacking in research?
did you
I was
honestly tell
honest.
them I'm
I
not
was honest.
interested?
Yeah, I was honest. I told them it's not really an area of interest for me.
I
You could-
like.
Sorry,
Yeah.
you could flip that around, by the way.
What do you mean?
When someone asks you on an interview panel, why don't you have this thing?
Why do you need it?
You can tell them,
Oh, okay.
I want to use your program to my advantage.
Ah.
I want to learn how to do research,
that's
for
okay.
example. Yeah, that's fine. Maybe when I go to UBC this year, they're going to, like ignite an interest in me about research. You never know.
I like the fact that there isn't this ideal, like, I always feel like there's this ideal standard of what we need to be, you know what I mean? To be able to go into residency or whatever. And I like the fact that that's not necessarily true.
It's not necessarily, and not at all. You don't work around the standards others set for you. Throw that idea out the window.
This is quote number 2 in this podcast.
everything that you do,
Yeah.
make the most out of it. It's your experience. No one is going to live that experience besides you. And you
love
have
that.
it's just all collective. You bring it all together, and then you put it into your application package and you send it to them. If they are impressed, that's a good thing. If they're not impressed, what can you do?
Do you think to some extent you need to have the attitude of, you know what, this is me, and
Yeah, be honest. They love honesty. You have no idea how far honesty can take you.
Really?
Yes. They love honesty. They love that you tell them this is a limitation that I have. I mean, obviously, don't, make yourself look bad.
Yeah.
But admit.
Don't put yourself down. But
Don't put yourself down. Don't cut yourself short. But let them know that you're self-aware.
Right.
I know that I'm not good at this, for example. Let them know that.
Right.
If they ask you something and you don't know the answer, like a medical question,
Right.
tell them I'll consult a senior. There's absolutely nothing wrong with that.
It's better to be honest about that.
Because
than to lie.
in the end, I went in with that mentality because I'm there to learn from you.
Yeah. Yeah.
So if I don't know something, you're obviously going to teach me this topic that you're asking me about.
Yeah.
But had I been in the casualty or the ward and I was faced with this situation and I didn't know, I'm sure that as an admissions officer, you would want me to know my limits and call someone.
Exactly.
You want me to be
because
safe.
it's patient safety in the end.
It's patient safety in the end.
Yeah. You know, one of the best pieces of advice I heard about applying for residency is that what they're also looking for, in the end of the day, forget all the research, blah, 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 blah. They also want to know if someone can be part of their team.
Yeah.
They don't want to bring someone who's going to ruin the vibe.
That's why the interview is going to make you or break you. If you have a solid interview, I personally don't think it matters what you scored, how good your CV is, how good your personal statement.
So you think
could be
that maybe
flawless.
The personal statement, all that just to get your foot in the door.
Yeah.
But then it's just
that gets you the interview.
Okay.
The real challenge is how well in the interview do you do.
We're actually going to have an episode very soon about interviews. For those of you listening, this just means that you need to stay tuned more for... seriously, this is actually on the books. We're going to have a chat about, applying for Canadian residency and interviews. But I love that because, I don't think a CV, the research scores, they don't say the full story, the full picture of a person.
That's true. And they know that, by the way. They know that.
And university, when you apply to university, they don't do interviews. In med school, they do.
Exactly.
But like undergrad, for example, applying to the States.
I don't think they do interviews. Yeah.
No, not at all.
Yeah, so as I said, it's your experience. It's your CV. It's not anyone else's experience. You get to put all the things that you've done, be proud of it, and apply, and you'll do just fine.
Now, the next part, applications during trainee years.
Yes.
Exams, in terms of, scheduling, all of that. What's your advice for applying for exams, all of that in trainee year?
My advice is, because it worked for me, so I'm just going to say it, take your exam early.
Okay.
Because, one, you're a fresh graduate. Take advantage of that.
Right.
All of the knowledge that you're going to be questioned about is at the undergrad level.
Yeah.
So what is expected from a fresh Canadian graduate? That's their standard.
Yeah.
And all of the other medical schools all around the world, they all have the same standard.
Right.
I don't believe that there's one medical school better than the other. It just depends on the individual, obviously. So take the exam early on.
Okay.
So that when you're done, you can work on your recommendation letters.
Right. Okay.
By the way, recommendation letters I cannot stress the importance of recommendation letters, because once they decide, or before they decide to accept you, like after an interview, for example, they're going to call the doctors who recommended you.
Now, here's one of my concerns, though, for recommendation letters. I think this is less of an issue if you're applying to Canada.
Okay.
But more like, for example, applying to the States, UK, et cetera, et cetera. Does it necessarily need to be like someone who's recommending, they're from their board?
Oh, no.
Okay.
No, that's a falsehood. That's a myth. Yeah.
Okay. Touch up on this.
The single most important thing about any recommendation, or what makes a recommendation really shine, is the content of the recommendation letter.
Can you read your recommendation letter after they write it for you?
Yes and no.
Ah.
Yes and no.
Okay.
Yeah, like sometimes they, you read it, and sometimes they send it. Depends on the doctor, actually.
Okay, but you're allowed to.
Yeah, you're definitely allowed.
Because
to
when
read the
I was
you're not going to
applying
change anything if they write it.
Yeah.
You're not going to change anything.
When I was applying to some programs in high school, either college or medical programs, I forgot. A lot of the recommendation letters are like, nope, they write it. You know, seeing it, just click send.
They send it not.
Oh.
Here everywhere else, you can read your own recommendation letters. It's fine.
And do you ever have you been in the place where you had to decline, kind of be like, I'm not going to send this. This is not.
No.
Okay.
Because I chose the right people.
How do you choose the right people?
You have to, first of all, the person who's going to write the recommendation letter has to see you, has to work with you really closely.
Okay.
And that has to mean something to you when they give you the recommendation letter. For example, one of my recommendation letters was from a senior specialist in the intensive care unit.
Right.
I developed a really close relationship with this person, and he was really influential in teaching me and being, a mentor for me. And when I got the recommendation letter, it was really personal. I felt like it's when someone reads it, they're gonna, it's convincing.
Right.
That's the whole point of the recommendation. You gotta convince the admissions panel that it's not, Aziz is the best doctor. He is the best You get what I'm saying?
Yeah,
It's not like it's not standard. It's not a template. It doesn't look like a template.
Yeah.
It's real, genuine words written by this person.
And
So,
they can tell
because
when it's genuine or not.
Obviously, and they call the person. So be careful.
And what if the person doesn't answer?
Oh no! They send emails. They call.
Okay.
Because you have to let them know. It's your responsibility, by the way. Tell them, put your phone number. They might call you.
Oh, right. Okay.
Yeah.
Okay.
So
do you recommend asking around for is this person good to get a recommendation letter from?
Yeah,
yes or no? Okay.
That's fine. You can do that. But as I said, make sure that the person who's writing the recommendation letter really knows you well, because it looks really bad if they call and they forget who you are.
Yeah.
Because
who's this?
Yeah. Who? Aziz? Yeah.
Oh yeah, that
might
guy.
happen. That might happen if you choose the wrong person.
Okay.
So that was one of the things that I had to get down and finish from before applying. That's why I took 2 ICU elective.
Do you need to be strategic in your electives that you choose to be able to get this out, or not necessarily?
Because I saw an opportunity. I said to myself that these ICU consultants at Amiri, they've graduated from the top schools in Canada. So they will obviously guide me through the process.
Right.
And they will be really influential. Plus, I'd learn, because in internal medicine, they really emphasize intensive care in their program, even in internal medicine. So it was really like a good, like a win-win for me,
Right.
So it was difficult, as a trainee especially, but it was really worth it in the end. I've learned so much from them, even though I had to change my schedule. And then after I finished from the second month of the ICU, it was just a lot of work after.
Yeah, apparently Kimzar is not too happy about schedules being changed.
Yeah,
for
that's
trainees.
fine.
Yeah.
What can you do?
Yeah, you got to do what you got to do.
Yeah, exactly.
A question about exams, and this is a personal question. This is something that I'm wondering. So, one thing in terms of planning my exams, one thing that I've struggled with is a piece of advice I've been told a lot is book your exam when you're ready. Don't go into an exam unprepared. Yeah, I don't mean unprepared. I mean it more as in don't go when you're not achieving the scores that you want to, whether it's on the question banks or whatever. Would you say that this is a healthy approach? My issue is that it's to an extent now, it's making me kind of always double question. I'm always nervous because I feel like I'm never going to be achieving what I want to.
I agree to an extent.
Okay.
Just don't go into the exam if you're not ready. But book it.
Book it.
Especially when you're not ready. Because when you book it when you're not ready, it's going to instill that, I don't want to say fear, but that sense of urgency that I have to study.
Do you think that there's a degree of taking a leap of faith or no?
Yes, obviously.
Yeah.
Because you're going into an exam that's going to test how much medical knowledge, like medicine, surgery, OBGYN, ophthalmology, ENT, all of these things. On top of that, medical ethics on top. So it is obviously a leap of faith. You really have to believe in yourself. And if you're going to always, keep telling yourself, am I ready? Am I whatever? You're never going to be ready.
You think so?
Yeah, I know so.
Right.
Because I've seen people keep, pushing the exam, telling themselves, I haven't really studied that much. I don't feel ready. I don't feel whatever. I went into my exam, by the way, really scared.
Okay.
I was really scared because I saw many people around me taking the exam in February, March, April, whatever. And I said to myself, well, why am I taking it 3 months after I graduate? But I still did it anyways, and it worked fine for me.
Well, I'll be right back. Let me just book my exam. Awesome. Now, thank you so much for all of this. This has been invaluable, knowledge. For me, it's been really eye-opening. Now I realize that I have a vacation that I didn't know existed. So that alone. Kind of towards the end of the podcast, one of the things that I like to offer up is, do you have anything that you want to promote? Instagram page, anything like that you want? Perfect. So I'm going to use the opportunity to promote the Doctor's Brew again. So for everyone listening, if you enjoyed what you heard, please like, comment, subscribe. And I think I mentioned this in the last episode. I don't know the YouTubers at the end, that whole monologue about comment, likes. Just do that.
Thank you so much for having me. It was a real pleasure. I had so much fun.
The pleasure has been all ours. I've had a really, really good time. And I hope that future interns or whatever that are working with you in Canada are just going to be so appreciative, because you've made such an impact in my trainee year, and I can't thank you enough for it.
I hope nothing but the best for you.
Thank you again. Hope you all enjoyed this episode of The Doctor's Brew. New episodes to listen to with a cup of coffee coming your way every Sunday on YouTube and Spotify. And be sure to follow us on Instagram for all the latest updates. See you next time.